Mr Smith.
Thanks very much and congratulations, Mr Cahill. Some of us work very hard to get our names in the West Australian newspaper.
That doesn't include me, Senator.
For all the right reasons. Just by way of background, Mr Cahill, can you just share with us what your experience is around these sorts of projects?
I've been a public servant for 40 or more years, and I've got a range of policy and operational background across a wide range of areas in various departments and agencies. I've been Chief Executive of an agency. I've undertaken significant procurement work in my previous experience, and also corporate services and governance.
Great, thanks very much. I'll start with you, Secretary, if I could. I came into the committee as you were giving some evidence around timelines, and you said that in 2014 work was being done. Which part of 2014, the first half or the second half?
Second half. I think it was
August 2014.
Right. Was it August? So it's the second half, yeah. And there was a whole lot of conversations. I mean, I only started in October, so I think things started around that August period, and I really got engaged in it after I started. So it was late when we were really dealing with the RFI outcomes.
Senator, I can sort of clarify that if you wish, Secretary. On the 8th of August 2014, the then Minister issued a media statement announcing the expression of interest going forward as part of decisions made in the 2014-15 budget.
Mm-hmm. Was there any work being done prior to that point? Was there any work being done prior to September 2013 in regards to a project like this?
We're talking 2014.
No, talking about the election. I couldn't say, Senator. I wasn't there, and neither was Mr Carl and the other people responsible for this. I would suggest there be conversations going for long periods of time around the payment system that is run by Human Services. Probably a question best directed to them, because they are the ones actually responsible for that at that particular point.
I mean, I'd hope there was a conversation happening in the previous government around improving the experience for consumers of Medicare payments. Absolutely. You talked about the current process being inefficient. Can you just elaborate on why it's inefficient and how it's inefficient? I have read reports of like 600 million transactions. Would you characterise it as paper-based? Would you characterise it as a digitised process?
It's a mix of just about anything and everything you want to think about, I think.
Is it a mess?
Well, the payment structure, I mean, Medicare has grown to deliver over a million services a day now. So there are significant transactions that go through Medicare itself, and then we have aged care on top of that. Mm-hmm. So significant amount of transactional work to make sure doctors and others are paid through this particular system. There's I don't know the intricacies of the system, other than it is a very complex. If you look at the system diagrams of this, you'd probably lay it out on the floor in the middle here. It's that sort of level of complexity, but it is built on technology that's now probably 20, 30 years old.
All right. So it's inefficient because it's 20 to 30 years old. It's complex, which sounds like a technical word. I'd probably call it a bit of a mess. Is it paper? Would you characterise it as paper-based?
Parts of it are. I mean, it's still built on an IT system, obviously, but there's paper issues, there's check issues, there's all sorts of things that still flow through the system.
So how would you describe the customer experience at the moment?
I can only probably describe my experiences when I go to the doctor, but I mean, it's complex for patients. It's not that obvious sometimes, particularly in the bulk billing context, what the payment structures are, because a lot of people wouldn't even actually know, because it's between doctors and Human Services around the payment issues. So the feedback we get, of course, is that it is a frustrating system for patients,
Mr. Cahill,
and doctors in particular, I think.
Can you? I'm probably more interested in the sort of the patient experience and the doctor experience. But Mr. Cahill, how would you elaborate? How would you demonstrate that it's an efficient process at the moment?
I'm just scratching the surface, Senator, so there's probably not much more that I can add to what the Secretary has said. But I think that it's not just about the experience currently that those using the system have, it's about what happens into the future. So you're talking about systems, as has been indicated, that have evolved over probably 30 years. Those systems would clearly are in need of development. So there's a need for investment in systems anyway. And so this process is really about making sure that in going forward and making that investment, you do so in a way that's very consumer-centric, that's user-friendly, that's flexible, that's agile, that can cope with future policy development in a way that's responsive to the community's needs.
So do you have any information about the timeliness or lack of timeliness that customers might be experiencing at the moment, something that in your project would be improved upon or would be expected to be improved upon?
Well, again, it's early days for me to probably comment too much on that, Senator. Clearly, going forward, we want to make sure that that experience is much better than the experience that people have today.
I'd hope so. It's been characterised as the privatisation of Medicare. Is that accurate?
I might take that one, Senator. No, Senator. It's looking at the commercial possibilities around the payment system around Medicare. I think when you talk about the privatisation of Medicare, conjures up a whole lot of things around privatising the medical services in that, and that's not the case. This is about looking at options around the payment systems for Medicare and aged care.
That's right. I mean, it's specifically, to quote the Minister, the project is investigating ways to digitise its transaction technology for payments. That is a big stretch to be calling it the privatisation of Medicare when it doesn't make sure that I'm clear on this. It doesn't go to issues around eligibility or policy. This is a investigation of ways to digitise the transaction or the technology for payments.
No, that's correct. Just to make it very clear, I mean, government policy around Medicare and all of those rebate issues, bulk billing, all of the things that go to make up the entirety of our system is a matter for government. And as senators would know, we have a whole range of review activity into the MBS system around some of the item numbers. We've also looking at the whole issue around primary healthcare through our Primary Healthcare Advisory Group, all of things that will come to government over time that go to Medicare more broadly. This issue is specifically around the payment mechanism once all of those policy decisions are made in the normal course of events by governments of the day.
Mr Cahill, are you familiar with the Centrelink's Express Plus application?
No, Senator.
It's been reported in the press. Your name wasn't in that article, so you may not have gone to it. I understand that. Well, it's an application that currently exists in Centrelink. It transacts 68 million transactions. So rather than being accused of having a sneaky plan, you could be accused of taking too long if Centrelink is doing these sorts of things already.
I can't comment on that, Senator.
Finally, Chair, I just want to go to a comment that John Deeble has made. Are you familiar with who John Deeble is, Mr Bowles?
Yes, Senator.
Who's John Deeble?
He did a lot of work in the early days of the Medicare Medibank and worked in that in the, whatever it was, 60s, 70s.
Mm-hmm. John Deeble's reported to say...
It was a bit of a test, wasn't it, hey?
John Deeble is reported as saying today, and the article regards him as co-authoring proposals in 1968 that were used to form the Hawke government's Medicare and before that the Whitlam government's Medibank. He has said that he had no problem with the efforts to make payments more consumer friendly and faster. This is a quote from Mr Deeble. He says, "It won't necessarily alter Medicare because it's the structure of Medicare. What money you get for what service, that matters, not who does the running of it." Would you agree with that comment, Mr Bowles?
That's effectively what I've been saying, I think, Senator. The basic
It
tenets...
was a very powerful endorsement from the author
I'm
of
so glad.
But
I mean, the basic tenets
modern Medicare, but it does have a long history.
The basic tenets of Medicare are a decision...
To Senator Smith.
Sorry?
You support...
No, I'm on the public record
Dr.
as supporting
Deebles.
co-payments. I'm on the public record as supporting co-payments.
Dr. Deeble doesn't. Dr. Deeble doesn't.
Order. Senator Di Natale, as fun as it can be,
As fun as it will be.
fun as
As
it
fun
can
as it
be,
will be, Senator
Senator
Di
Smith's
Natale,
not a
yeah.
witness here. Senator Smith's asking questions, and you will have your turn to ask questions.
I'm just being cheeky.
Senator Smith.
That's right. I think the Federal Labor Health Minister proposed co-payments, but that'll be on the record. So, Mr Cahill, do you support the comments of John Deeble?
I support the Secretary's comments about the comments of Mr Deeble.
Very, very wise. You'll go a long way, Mr Cahill. Well, you have gone a long way, but thanks very much, Chair.
Thank you.